Thank you. Very nice to be here and so lovely to continue the talk around Tasty School, which is a project we've been working on together with my colleague Aya that just presented you the other results. As said in the introduction, I'm a PhD student, but I just had my dissertation in April, so I'm kind of finally almost done. Um, But the Tasty School idea of, well, my presentation is going to focus on the children, which were kind of missing before and were asked after there. But the model is kind of, what we were thinking is that the knowledge or the research shows that we can influence the eating patterns and food skills of children at school. So when building Tasty School, we wanted to give practical tools to the schools and to the teachers of how to do this, how to affect the eating patterns, and how to develop the food skills. And in Finland, we have quite a good basics to do this, because we have the tax-funded school meal systems, which has been going on for 70 plus years. And we have the national school meal recommendations that kind of come from the national food recommendations that come from the Nordic food recommendations. So they are all pretty well in line, and the municipalities that are responsible for implementing or put in practice the school meals, they follow these recommendations pretty well. And that is actually even followed. That the municipalities have to say that, do they follow the national meal recommendations? And they say that, yes, we do. And also, in the national curriculum for basic education, we have food education, as Aya just mentioned, and was kind of asked after. So, building on that, we built on the Tasty School model, and what we have there is the materials and support for the schools. So there's the website including idea bank and information, online training, and self-assessment for the schools, for the teachers. We had a monthly newsletter and a blog. We gave the schools a tool package of kind of sensory-based food education. How is that done? Using all the 5 senses around food. So we wanted the schools to implement the sapere method kind of too. We gave them some print materials, for example, around our dining rules in the school cafeteria. And there were optional webinars for the teachers, and we also visited the schools during the intervention. So at the school level, we had 1 or 2 named coordinating teachers that were kind of responsible of the Tasty School. They were our contact at school, but also was their work to make sure that their colleagues at school knew about the Tasty School and kind of spread the word there. And we had one day live training for them. Then we had the self-assessment questionnaires for the schools, and we interviewed the principals that how did they do. And at the teacher level, kind of the main guidance was that we wanted them to do something around food education monthly. Do at least one, or use one idea per month, and use around 30 minutes to do it. That was kind of the minimum what we wanted them to do. So let's get to the children. The children we gathered the data from were from age 9 to 12, so the grades from 3 to 6 around. And we had 2 groups, the intervention and the control. And of course, these are the same as in Aya's presentation. So there were 15 intervention schools and then 10 control schools. And altogether, we got the data baseline and after from 1,480 children, and little less than, or little more than 1/3 for control. So we had a slightly bigger intervention group. And what we measured from the children were frequency of eating school lunch. So how often in general do you eat school lunch? And also we measured or asked the children that how often do you eat each component of the school lunch? And in Finland, our recommendations kind of divide the school lunch all together into 6 pieces. There's the main course, there's the salad, there's bread and oil spread, there's dressing for the salad, and there's the drink, milk or buttermilk or so on. So we asked about all those. Then we asked the children about their school dining experiences, that how do you feel the atmosphere, for example, when you're eating? How do you find the food? Is it enjoyable? Then we asked about the children's eating competence, and we asked about their body image. How do they find that? And we did all these baseline and after the intervention. So the intervention started when the school year started in October, in August, and it was supposed to end when the school year ends. But this was 2020, so Corona or COVID-19 hit us, and we had to change the schedule a bit, and we gathered the data a bit earlier than originally planned. So the intervention lasted from August till March instead of the end of the school year in April, May. What we wanted to know more was that how did the schools implement the Tasty School? And we gathered this information from the principals. So we asked we did interviews for the principals, and we asked in the intervention group schools that did they include food education in their school year plan, and did they have any projects around food education that gathered or was in the whole school? Did they see any positive changes, and are they going to be a Tasty School next year? And also in the controlled schools, we did interviews and asked them that did they do any school education activities? Because we were in contact with those too, and we kind of saw that part of them were quite active because they were interested in the project and they got interested into food education. And we asked them also that did they use the Tasty School material, which was online and available for everyone. And we found out that actually the control schools part of them were quite active too. So eventually in our analysis, which was done with mixed effects model, we had to divide the schools into 4 groups. So we had the committed intervention group, the uncommitted intervention, the active control, and the inactive control. And let's get to the results. What did we find? So we found that the active food education in the whole school context increased the intake of balanced school meal. And here, when you look at the numbers, you might freak out that how can they be so low? But we defined the balanced school meal so that the child eats all 5 components of the school meal that is offered. The only one we counted out was that they don't have to use the oil on top of the salad. But there has to be the main course, the bread, the oil spread, the salad, and the drink. So that's why the numbers are so kind of low. But we found out that in the committed and the active control groups, the numbers did grow quite nicely. in kind of short time, from August till March. So very nice results. So we also asked the children how did they feel about school meals. And the only question we found changes in was that the children felt that they get to participate more in planning the school meals. So the schools, they had the chance to implement the Tasty School how they felt. So it seems that they wanted to participate, the children too. So it wasn't too much teacher driven, but they involved the children to do food education together. So at least the children felt that they got to participate more in planning school dining. And we also found that during the intervention year, we got the children's eating competence to grow a bit. And these results, also, I don't know if you're all familiar with the eating competence model, but that has altogether 4 different dimensions. And what the changes were seen in was the food acceptance subscore. So the children whose eating competence grew or got better, they accepted new foods a bit more. So to sum up, we found that the Tasty School model is an effective model to improve the children's eating patterns and to increase children's participation in food education. But it seems that effective food education really requires commitment from the school. So that is, I feel that that's pretty well in line with the previous presentations we just heard, that we need the whole school community to work around food education to get effective results. Thank you.